Hello, my name is Kate Lathrop. I'm the program director for the San Antonio Breast Cancer Symposium. And today for our snippet, I'm interviewing Dr. Van Veer, who is our McGuire Award recipient this year. She gave a wonderful talk this morning following our general session. And we've invited her here to ask her a few questions and glean a little more insight from her great career in breast cancer. So the first question I wanted to ask you, if it's okay, is, you've been instrumental in developing some of the biomarker-driven tests that we use every day in the clinic. How should we start to really utilize these in our clinical trials and research so that we can move the field forward? Mm-hmm.
Thank you for this question. And also, I'm very thrilled to have been awarded the McGuire Lecture Award, which was a big thing to actually talk about, like 20, 30 years of working in this field. I've been sort of interested to understand the biology of the cancer, in most cases the breast cancer somebody is diagnosed with. And because that can give you insights how treatment should be given. So what is needed, maybe some patients can forgo severe chemotherapy, others need better targeted therapy. So that's been sort of the lead motif in all that I've been doing. And so it was really bringing the knowledge from molecular biology scientists from research into the clinic, which we did by establishing the test MammaPrint. So then subsequently we thought, okay, if we now know who is at high risk for recurrence or low risk, how can we utilize that in our clinical trials today? And so we started to actually participate in the trial system I-SPY, and I moved from Amsterdam to San Francisco to be able to do that, to actually guide who needs targeted therapy in addition to chemotherapy, and to show actually over the years, because this is going on for almost 15 years, that you can, based on the biology of the tumor, identify who needs what type of chemotherapy plus targeted therapy. And so I'm talking about immune therapy, which is the new effective therapy for many cancer types, which traditionally actually was given only to triple negative breast cancer patients. But what we showed in the I-SPY 2 trial, looking at the biology, that there's actually a subset of the hormone receptor positive, HER2 negative breast cancer who equally well respond to immune therapy. And so you need to look across the boundaries of receptor subtypes, hormone receptor sensitive tumors, triple negative, HER2, but look under the hood to see what is the other biology active, who have an immune sensitive tumor, who have a DNA repair inhibitor tumor. And so if you rearrange the subsets of tumors from traditional receptor subsets to the ones that are responding likely to certain therapies, you actually can increase the overall response rate from 4 in 10 to 8 in 10 in many of the cases. So there's really a lot of benefit to gain to understand the biology of somebody's cancer.
Yeah, I think those are great points. And, as you were speaking, I was just reflecting, I myself am putting patients on clinical trials based on their MammaPrint scores for immunotherapy. And it must be rewarding to see that work actually move its way into clinical trials. What advice would you give to, people who are designing these trials right now and want to start utilizing maybe the next generation of these biomarkers for breast cancer? What advice would you give those investigators?
I think it's good to team up with a team of investigators. So you need the clinicians to understand what is acceptable as a treatment, right? Because every treatment may have toxicity. So you need to understand what is feasible to give. It's also very important to work with patient advocates because they have their own very strong agenda, what is needed right now. So that gives the point of urgency. And then to look around you, there's so much going on in AI, in biology, and understand the biology of everyone's tumor, as well as the makeup of the patient itself, to actually match the best treatment to the tumor of a patient and their background.
Yeah, great points. I know your last few slides for your presentation today focused on your family and people who had influenced you through your career, and I could tell that was very meaningful to you, and you wanted to, shout out and thank those people. What advice would you give to somebody who might be starting out in their career, either a physician or a basic scientist? What would be your one piece of advice for them?
Well, I think first of all, I love my work. So I could do this like the whole day, but a night maybe. But I think there's very much a work-life balance. So I think that you have other things besides work is important to stay healthy yourself and also be able to think about new things. So I think it's the work-life balance that actually will help you in the end the best.
Wonderful. Well, I can't thank you enough for taking the time to do this snippet with me, and congratulations again on winning the McGuire Award.
Thank you very much.